Hello guys, this is Adip. Welcome to my channel Movement Science, where I simplify biomechanics with Joe. So if you're new to this channel, consider subscribing. Also check me out on Instagram, where I post pictures of my notes and also put out some daily MCQs. The reference time for all the topics that I'm going to cover will be mentioned down in the description, so check that out and let's get started. In this video, we are going to talk about the cervical spine. The previous videos I have discussed about the vertebra, their body structure, ligaments, kinematics and kinetics in a very generalized form. So now we will be talking about each segment or the region of the spine, and we will be talking about their structures and movements in a very specific way. Okay, so this video will be about the cervical spine. We will be mostly focusing on the upper cervical spine. We will see what are the structures, that is the atlas, axis, the bones. We'll see the articulation and also the ligaments. Okay, so let's start with the topic. So your cervical spine can be divided into two parts, the upper cervical region and the lower cervical region. Now upper cervical region, which we will be talking about today, is also called as the craniovertebral region. That is basically cranium means your skull and the vertebra is the spine. So there are types of vertebrae. There is the typical vertebra and the atypical vertebra. We have talked about the typical vertebra in our previous video, which has a body, the transverse process and the spinous process, right? Those are the typical vertebrae, but there are also the atypical vertebrae which do not follow the exact same structure of the vertebrae. So those are your C1, C2 and C7. Now C1 is called as the atlas, C2 is the axis and C7 is the transition vertebra, where the cervical spine turns into the thoracic spine, right? So that transition vertebra is also slightly different. So these are the atypical vertebrae. So let's start with the first atypical vertebra, that is the atlas. Now let's look at the atlas first. So this is your atlas. As you can see, there is no body that atlas has, and also the transverse process over here, there is a hole. And also spinous process is not prominent at all, right? So it's very different from a typical vertebra that we see. So the atlas, its function is to cradle the occiput and transfer the forces to the lower cervical vertebra. Now occiput will be on top like this and articulating with the superior facets, these superior big facets of the atlas, right? So what it does, it nicely cradles the occiput and also transfers the forces to the lower cervical vertebra, which is why there is no body that it has, and there are just two large facets to transfer the forces. It also has a foramen for vertebral artery. As I said, there are the foramens over here, you can see at the transverse process through which the vertebral artery passes. Okay, and there is the superior articulating surface. These are the two superior articulating surface which are large and concave. Okay, they are concave and large, and they are also kidney shaped. Okay, this accommodates your condyles. The convex condyles from the top will be taken up by your kidney shaped large superior facets of the atlas. Then there is also inferior articulating surface which is slightly convex. So I turn it around and you can see these are the two inferior articulating surface which are slightly convex. Okay, and then there is another facet. It is the facet on the internal surface which is there for the dens. Now what is dens? Dens is a part of your next vertebra, that is axis. So your atlas articulates with the dens of axis. So where is the facet of that? That is over here. It is in the internal surface of your atlas over here, the red one. You can see this, right? So these are your superior articulating surfaces. Then this is your articulating surface for the dens, and then inferiorly these are the two inferior facets. Now let's move on to the axis and see where the dens is present and other structures. Now this is your axis. Okay, so if you can see again, this one also doesn't have a proper body. There is a nice anterior projection that you can see, and this is your dens, this anterior projection, if you can see, and these are the two articulating surface, superior and then inferior articulating surface. Over here also there is a foramen for passage of your artery. Dens over here, it transmits forces and provides axial rotation. The rotation is provided by your axis at the cervical spine, and the dens has superior facet which articulates with the anterior arch of the atlas. Okay, now this is the dens, and this part is the superior articulating facet that I was talking about. Now this one will nicely articulate with your atlas. If you can see properly, this is how it articulates right at the anterior arch of the atlas, right? So this is where your dens articulates with the atlas. Now apart from that, there is also the superior facet which faces upward and laterally. So these are the two superior facet which are facing upward and also slightly laterally. Okay, so these are the two superior surfaces, and then there is the inferior facet. I'll turn it around, and these two small inferior facets are present which kind of face anteriorly. If you can see, this is the body and this is the spinous process, right? So they are facing slightly on the anterior side. So apart from this, there is also the transverse ligament which is attached to the dens, which we will talk about in a while, and also the spinous process. They are bifid. Bifid meaning they split into two. Over here the spinous process is broken, but if I want to show a bifid spinous process, this is what it looks like. The spinous process doesn't just become one, it splits into two parts, right? So this is a bifid spinous process which is seen in the axis. Okay, now going to the articulation. This articulation is exactly what we have discussed over here, but I just wanted to go through it again so that you get a proper idea. So first we saw the Atlanto-occipital joint. Now this is the joint between the atlas and the occiput, and there are two articulations that are happening. That is the concave superior surface of the atlas. So let me get that first. Over here is the atlas, and this is the concave superior surface, and the convex condyles of the occiput which will be sitting on top, right? So 1 and 2, these are the two articulations that are happening over here. They are true synovial joints, which is quite strange, right? We would expect a small joint like this to not be a synovial joint, but it is a synovial joint, and it is almost in horizontal plane, right? If you can see, it's almost in the horizontal plane, and it has intra-articular miniscoid and fibroadipose structures. Now next one is the Atlanto-axial, that is between the atlas and the axis, and there are three articulating surfaces over here. The first one is the median Atlanto-axial joint, which is a synovial, trochoid or pivot type of joint, and it is between your dens and the atlas, which we just talked about. So for that I wanted to show the movements also. So let me remove this clay and show you how exactly the movement occurs, and also the articulation, how it occurs. So articulation you have already seen. The anterior part of the dens will articulate over here like this, right? And the rotation will be occurring like this, right? So this is the articulation between your dens and the axis. That is the first. Median means what? In the center. And the Atlanto, this is the atlas, Atlanto-axial joint between the dens and the atlas, right? Next one is the lateral joints between the superior facet of the axis, that is your axis, the superior facets of the axis, and inferior facets of the atlas. This is the atlas, these are the two inferior facets. They'll sit right on top of each other like this, and these are the other two. So total 1, 2, and the median only one is there, right? So there are the three articulations that are happening at the Atlanto-axial joint. Now the axis rotates between the osteoligamentous ring that is formed by the anterior arch and the transverse ligament. So the axis is over here, right? And this is the dens, and if you can see, dens is present right behind the anterior arch, you can see, of the atlas, and there is another transverse ligament which we'll talk about right after this slide. So that one is present right behind it. So the dens rotates like this between the anterior arch of the atlas and the transverse ligament, and it kind of creates a circle over here. I'll show you guys in a while. So that's how the rotation happens over here. Okay, so now moving on to the ligaments, the craniovertebral ligaments, that is the ligaments between your skull and the vertebra, will be the transverse ligament, the alar ligaments, and then we will have the ligamentum neutral or nuchae, I don't know, and also some of the longitudinal ligaments which we have previously discussed, but they just have a different name and some different features. Okay, so we'll start with the transverse ligament, which is the most complex one, and there are a lot of structures over here, compact. So you might feel a little bit intimidated, but we'll break it down. So if you can see over here the arch, this is the atlas, okay, and right below it is the axis, and this brown structure is the articulation between your atlas and axis, the capsule, and then your atlas articulates with the occiput, right? So that is the articulation over here. Now this blue thing that you can see across, going across, is the transverse ligament. So I have noted over here transverse ligament. This is the superior, inferior, and this is the alar ligament. So first we'll look at the transverse ligament by looking at the atlas from the superior view so that we get a better idea. So if I get the atlas over here, if you can see, this is the ring that is found by the atlas, and the transversely going ligament is the transverse atlantal ligament, okay. It goes across the ring of atlas, and anterior to it there is dens, and posterior to it there is spinal cord. Now if you see, we have discussed how dens articulates over here anteriorly, right? So dens is anterior to the transverse ligament, and posterior, the hole that you can see over here, through this your spinal cord will pass, okay. And the next one is anterior surface has a cartilage. So the anterior surface has some amount of cartilage which will articulate with the dens, and also there is the superior longitudinal ligament on the posterior side and the inferior fibers, okay. So that would be present over here like this, okay. So this is the anterior side, and posteriorly there will be superior ligament, inferior ligament, and this is the transverse ligament. So the superior longitudinal ligament, it will go and attach to the occiput on top, and the inferior one will go and attach to the posterior part of the axis, because axis is below it, right? So it will attach to the axis over here like this. So this is how the attachment occurs, and if you can see, it forms a cross, the blue and the red, right over here, it forms a cross, and this is called as the atlantal cruciform ligament. So that is your atlantal cruciform ligament, and articular surface holds the dens, okay. The dens is held in place by the articular surfaces over here, and C1 and C2 stability is provided by your transverse ligament. Transverse ligament is playing over here a very big role, that is the C1 C2 stability. Otherwise the atlas would have just displaced, right? Because of the transverse ligament, it holds everything in place. So the C1 C2 stability is provided by your transverse ligament, and the superior and inferior ligaments also will assist over here, right? Over here, and it will also go and attach to the occiput on top. So that's how your C1 C2 stability is provided. Another very interesting thing about the transverse ligament is it is very strong, and dens, that is the bony structure that we have seen, will break sometimes before even the ligament breaks. So if there is a very strong force which is present on the C1 C2 vertebrae, right, your ligament won't break. Before that the dens will break and ligament will be still intact. So this is seen in the cervical spine, which is very fascinating. The ligament is so strong that even the bone will break, but the ligament will hold on. Another point I want to add over here is the strength of the transverse ligament is sometimes compromised in conditions like RA, that is rheumatoid arthritis, and also Down syndrome, where there is C1 C2 instability seen because of the laxity of the ligament, okay. And also in the traumatic cases, obviously there can be injury to this ligament, which can cause a lot of problems because spinal cord is passing right over here. So if there is any displacement of the C1 on C2, the whole spinal cord can get compressed and can cause a lot of problems. So now the complex part is done. Now there is the also LR ligament, and also if you can see over here brown is the deep part of the tectoral membrane, which we'll be talking about in a while. So alar ligament is paired into over here, and it goes from the side of the dens. So I get the dens over here. From either side of the dens, it will go and attach to occipital condyles on top, and also slightly on top there is the atlas, right? It will also go and attach laterally to the atlas. It is around 1 centimeter long, and it is of the pencil width. So it is attaching your axis to the atlas. So if you know that it is attaching your atlas to the axis, what will it prevent? It will prevent C1 C2 distraction, correct? And also because it is attached to the dens, during axial rotation of the head and the neck, it will tighten the alar ligaments, and also it will be lax in neutral position. In neutral position, When there is no movement, it will be lax. Whereas there is flexion, there will be tightness of the alar ligament. Also, there is the right upper and left lower parts of the alar ligament which will prevent lateral flexion. Okay, that is something you can keep in mind. Again, it's not that important, but still important enough to draw your attention to, like what are the movements it will present. Just remember where they are attached and you'll know their function. But over here, transverse ligament has a very big function, that is the C1 C2 instability, which you cannot simply miss. Now we'll go on to the last two ligaments and we'll finish off the topic. So now we'll be talking about the ligamentum neutral and the longitudinal ligament. Now ligamentum neutral is also, some people say it's evolution of the supraspinous ligament. It is very thick, it is triangular, and it is sheet-like. Okay, it is also very superior, and external occipital protuberance and foramen is where it is attached on top. And as you come inferiorly, it will be attached to the tip of the C7, that is the spinous process of C7. Now it has two parts, there is the dorsal raphe and also the ventral midline septum. Okay, those are the two parts that ligamentum neutral has. Now dorsal raphe, it is narrow strips of collagenous tissue which is interlacing with the tendons like upper trapezius, splenius capitis and rhomboidus minor muscle. Basically what it means is your ligamentum neutral is attached to all these big muscles like your upper traps, and then some small muscles like splenius capitis and also rhomboidus minor, which is a fairly big enough muscle, right? So it is attached to these. And also the other part, that is the ventral midline septum, it runs ventrally, that is more on the anterior side, on the dorsal raphe, and it continues with the interspinous ligament. So it is more on the anterior side of your body, and it is in very close contact with the spinous ligament, interspinous ligament, and at the AA membrane. What is AA? That is the Atlanto-occipital membrane and fascia of the semispinalis capitis and splenius capitis. These are the deep muscles, so it is quite deep and very close to the vertebra. It is attached to vertebra and is capable of resisting flexion. Okay, because it is on the posterior side, obviously it will be the one which will be preventing flexion. So it is very similar to your interspinous ligament, you can say. Now see over here, I've talked about so many muscles and we have kind of gone into the depths of the anatomy over here. Not a lot, but still enough for you to think that it's a lot of terms. But don't be scared of the so many terms. Just read them and try to absorb them and keep them at the back of your mind, because when you'll be reading about some other topic, you'll always find some connection that you'll have with this topic, and that's how you form those connections and create a whole concept in your mind. Okay, so keep these things at the back of your mind. You might not have to remember everything by word, but make sure that you pay attention to what are the structures that are present. Okay, and now let's go on to the last part, that is the longitudinal ligament. Now this one I've already talked about in our previous videos, the longitudinal ligaments, right? The anterior and the posterior longitudinal ligaments. And if you remember, in the upper cervical region, they had just different names. So that's what I'm going to address over here. So the first one was the ligamentum flavum. So the posterior Atlanto-occipital and the posterior Atlanto-axial membrane, which was there, it is also called as the ligamentum flavum. It is less elastic and gives a high range of motion for rotation. Next one is the anterior Atlanto-occipital and the Atlanto-axial membrane, which is again very thick. Okay, then next one is the tectorial membrane, which continues as a posterior longitudinal ligament. If you can remember, try to recall or just go back and watch the video again, where the posterior longitudinal ligament in the cervical region, it was called as the tectorial membrane, right? So that is again broad and strong membrane which originates from the posterior vertebral body of the axis and covers the dense and cruciate ligaments. Okay, so if you remember, I had just mentioned in the previous slide, right over here, this I said were the deep parts of the tectorial membrane, right? So they are in close relation with all these structures over here. So now over here again we are talking about the same thing. They originate from the posterior vertebral body of axis. It covers the dense and cruciate ligaments, right? The cruciate, the atlantal cruciate ligaments that we just talked about, ligament, and inserts into the foramen magnum, right? So these are the longitudinal ligaments. So with that, we finish up this topic. Now let's summarize. First, we saw the upper and lower cervical region. Upper has the atlas axis, which are the atypical vertebrae, apart from your C7, right? That is a transition vertebra. In atlas, what did we see? It cradles the occiput, big superior surface, one surface for the articulation of the dents, and then two inferior surfaces. It doesn't have a body, and transversely there are foramens for passage of vertebral artery. Then axis, we saw the dents which articulates with the superior part over here, and then there are the inferior articulations also. Also we saw in axis it helps in rotation, right? So then we saw the same articulations over here, and then we moved on to the ligaments. Under ligaments we saw the transverse ligament and the superior inferior ligament, which was forming the atlantal cruciform ligament, right? Then we also saw the alar ligaments from the dents going to the occiput and the atlas and preventing Atlanto-occipital distraction, whereas the transverse atlantal ligament, it was giving the C1 C2 stability, right? And then finally we moved on to ligamentum neutral, which is more of a evolution of supraspinous ligament, which has two parts, the dorsal raphe and the ventral midline septum. And then finally we saw the longitudinal ligament, which basically has different names in the cervical region. So that's what we addressed: the ligamentum flavum, the tectorial membrane, and the anterior atlanto-occipital and atlanto-axial membrane. So with that, we finish off this topic. That's all for today, guys. Thank you for watching. If you like my video, please share it with your friends. Don't forget to hit that subscribe button and also like the video, as it really helps me out. Also let me know in the comment section what other videos you would like me to cover. And see you soon in the next video.